Our word of the day today is Dirofilaria immitis, the fancy Latin name for heartworms. If you have a pet, you've probably heard the name heartworms more times than you can count. Heartworm testing, heartworm treatment, heartworm prevention, heartworm this, heartworm that, blah, blah, blah. And you've probably asked yourself, why is my veterinarian so obsessed with heartworms? Well, heartworms are just as gross as they sound. An infection can be deadly, but it's very preventable. So we're going to talk about how the disease works, how to test and treat for heartworms, and why you as a pet owner should care about all of this. Today, we're making soft pretzels and beer cheese. I won't go into a comparison of why when you're making your soft pretzels, you roll it out before twisting it, and it kind of looks like a long worm, and it's best just not to think about it. Just let it be its own separate entity. Let's dig in. Welcome to episode 5 of Dig In with Dr. Steph. I'm Dr. Steph, a veterinarian who loves to bake. In my videos, we'll talk about a pet care topic while we bake a fun recipe. If you're more interested in learning how to make these soft pretzels and beer cheese, skip to the time listed above to get to the recipe. I also post all of my recipes and more fun information on my website at drsteph.com. Okay, I changed my mind. Let's make the word of the day prevention. Because when it comes to this disease, prevention is way easier than treatment. So just keep that thought in mind as we talk about this disease. So what is heartworm disease? It is yet another parasite, and this one is spread by mosquitoes. When a mosquito bites an infected mammal species, whether that's a coyote or a wild fox, or rarely a human, it can suck up tiny baby heartworm larvae from the blood, where they then develop for a few days into the super gross infective stage larvae. Once they reach that point, the mosquito goes and then bites a non-infected host, and when it does that, it spits up these infective larvae onto the skin. So how do they get in? They travel through that gross hole that the dang mosquito made when it bit you and gets into the bloodstream that way. That's when they start to act extra disgusting and do their whole parasite life cycle reproduction thing. The life goal of a parasite is to grow up, feed on the host, and then make as many disgusting baby parasites as it can. So basically, a parasite's true dream is world domination. Ask any of them, they'll agree. Once the larvae hit the bloodstream of your pet, they'll start to develop into bigger and bigger worms. When these worms reach their full adult size, they can be up to a foot long and live for 5 to 7 years. That's basically like a cooked spaghetti noodle living in the arteries that supply your lungs for about the length of time it takes to get a solid PhD degree. Nobody's getting a successful PhD with cooked spaghetti in their heart. So it makes logical sense that a dog infected earlier in the stage of disease with smaller worms in their bloodstream have less severe signs than when dogs have worms that are in their spaghetti noodle phase. So an infected dog earlier in the stage of disease may show no signs at all, and as it progresses, might develop a cough or have fatigue when exercising or start to lose some weight. A severely infected dog can die from blockage of the heart with these worms. Warning, here's a super disgusting picture of that. And we call this cable syndrome. At this point in disease, one of the very few things we can do for treatment is to physically, surgically open up the blood vessel with the worms in it, take some big old forceps, and physically pull out wads of those worms. If that doesn't sound like a very good option to you, you're right, it's not. So let's talk about testing. So back to our word of the day. It is way easier to prevent these things from happening than to actually treat. Heartworm testing is important for this reason. Your vet may recommend heartworm testing at various points in development or stage of disease, like at 6 months of age or 7 months of age, for example, or 6 months after an initial negative test in a suspect infected patient. And this has to do with that life cycle we talked about. And so when the parasites reach a stage where we can actually detect it. In an infected patient, multiple modes of testing might be recommended, and in your healthy dog coming in for an annual vaccine exam and physical exam, we're gonna wanna do a yearly heartworm test. This is A, to make sure your prevention is working, and B, so that we can continue on our merry way of prevention without worrying that we might have missed a positive time point when treatment should have been initiated. So what if it is too late and my pet is heartworm positive? Let's talk a little bit about treatment. Because of that super gross life cycle that you and I now have a handle on, treatment comes in several steps. Not so fun fact, a dead heartworm in your dog's bloodstream is still dangerous to their health. Remember, a spaghetti noodle doesn't have to be living in order to clog up your dog's heart. There are several steps leading up to the phase where we give an injection to actually kill the worms, and this is to protect your dog from the complications that can come from killing the worms. The course of treatment is complex, and I won't go into all the details, but if you do want more information on that treatment protocol, I will post a link to the American Heartworm Society's recommendations on my website. One important thing that you need to know as a pet owner while you follow the recommendations that your vet gives you is to exercise restrict your dog. Leash walks only, let them be a couch potato, and this is to avoid further damage to their heart and lungs during the course of treatment. Let's talk a little bit about cats and heartworms. You've heard me talk a lot about dogs and heartworms, and there's a reason for that. Cats are considered an atypical host for heartworms. Few heartworms reach adult phase in their body, and typically if they are infected, it only consists of a few worms at a time. But this doesn't mean that cats are in the clear though. I know, it sucks. A cat can actually die from one adult heartworm. What makes it worse is our antigen testing is based on detecting young female worms, so if your cat is only infected with one heartworm, there's a good chance it could be a male worm, and we can't detect it. To make things even worse, the same heartworm treatment we use to kill the worms in adult dogs cannot be used in cats. So other than some supportive medical treatments, there's not a ton we can do for them. Kind of sounds like we're backed into a corner, right? We really are when it comes to cats. All we can really do here is, wait for it, prevent the disease. So let's talk about just that, prevention. Preventatives come in many different forms. Topicals or spot-ons, chewables, and sometimes injections that last somewhere between 6 and 12 months. A lot of the chewables and spot-ons also cover intestinal parasites, which is a nice added bonus. These products require a prescription because they are FDA-approved medications, and they should be given under the supervision of a doctor who knows the pet's life stage, whether or not they might be positive for heartworms, if they're positive or if we're waiting on a second negative test, and so on. The good news? You can also give preventatives to your cat. Just make sure it's a product that's labeled for cats. A big question that I get a lot is when to give these preventatives. Some people decide to give these to their dogs seasonally and don't give them year-round. If you're in a coastal area or close to the equator, we used to say these are the main areas to give prevention year-round. You know, like Florida and Mississippi, where the state bird is the mosquito. But these recommendations are changing because mosquitoes' habitats are changing. It's super gross, I know. And they're expanding to more than just these hotspot areas of the country. So regardless of location, I recommend that you consider giving your dog preventatives year-round to avoid any sort of lapse in treatment and the potential for them to get this disease. So what did we learn today? Let's recap with my big tips for pet owners. Number 1, prevention is key. Give those preventatives and consider giving them to your pet year-round to avoid the potential for this disease to develop. Number 2, testing is required. At the very least, annual testing is going to be recommended for your pet, and more frequent testing if there's suspect disease or a lapse in treatment. Number 3, if your dog is positive, follow the treatment recommendation protocol by your veterinarian and restrict exercise in your pet. Our goal is to get one step closer to a parasite-free world for your pets, one cat and dog at a time. Thanks for watching. I hope you learned a few super gross but important facts. Keep watching for the recipe at the end of this video, and remember to subscribe if you like my videos. If you're a new subscriber, please leave me a comment so that I can say hello and welcome you to my website. If you've been watching my Instagram or Facebook page, you know that I'm about to start a 30-day creative baking class online that I'm really excited about, and I'm excited to share some of my new recipes with you guys. I'll probably be going over a few recipes that I've come up with and maybe a few that I'm learning along the way as well. Thanks again, and I'll see you next time. Bye!